Good afternoon, everyone. Dr. Markle at Centeno-Schultz Clinic. Today we're talking a unique spinal condition called dural leaks. We're going to go through all the symptoms, symptomatology, why it happens, how it happens, as well as what can be done for this, and things if you're dealing with the dural leak currently. This video should show you some traditional approaches to help it, as well as things we might be able to add to that to prevent the need for something like a dural repair or a big surgery for this. Now, dural leak is essentially just some spinal fluid leaking around your spinal cord that can create severe headaches. So the basic anatomy of your lumbar spine from a cerebral spinal fluid flow, the fluid around your spinal cord is actually made in your central brain called the choroid plexus. That creates a lot of fluid, and this cerebral spinal fluid, or CSF, is how your body nourishes and supplies nutrients to your central nervous system, meaning your brain stem, as well as your spinal cord. And people can spring a leak anywhere along the course of this pathway that actually creates a leak in the system that can start creating some issues. Now, how a leak actually occurs, there's lots of things that can create a leak in your dura. Your dura just is the sac that holds all that fluid and contains it. So head trauma or any type of spinal trauma can cause a puncture in there. If some people do interventional procedures for diagnostic testing, such as lumbar puncture, epidurals, catheters, and certain surgeries around your spine, they can all lead to tears or leaks in this dura itself. There can also be different problems with production of your CSF. It could be not producing enough, producing too much, and sometimes patients that we see have a lot of times underlying conditions with their collagen, meaning their connective tissue disorder, and they're too loose or their collagen just isn't as strong as it should be, creating some leaky areas, and that's a condition called Ehlers-Danlos syndrome, or EDS, or Marfan syndrome. You can also, for degenerative things, there's bone spurs that can form, can actually poke a hole in the dura as well. So there's lots of things that need to be explored to figure out why this leak is occurring before we can really address how to really solve it. And these are just sort of the more common underlying conditions that we see on a daily basis that cause a dural leak. Now, symptoms of a dural leak. Typically, if we look at globally, a postural headache, meaning when you stand up from lying down, headache gets extreme and severe. When you lie flat, the pain goes away, meaning that pressure can normalize with you lying flat throughout your entire CSF flow, versus when you stand up, all the pressure, if there's a hole in the bottom of it, is leaking at the bottom of it and putting pressure actually on your central nervous system, creating severe headaches, migraines. Some people get double vision, hearing or ringing in the ears, light sensitivity or sounds. Some people describe these as migraines, balance problems. A lot of people have neck stiffness. Some even get so severe where they have nausea and vomiting. And some people get actually pain throughout the nervous system, such as arm pain, leg pain, radicular symptoms, depending on where the leak exactly is. Now, how do we diagnose when we're suspicious of this? We can do one of two things. We can do a MRI with contrast, where we're looking to see, well, where the leaks are. The picture on the left here is showing someone with EDS, meaning their collagen isn't holding their body together properly, creating some holes up and down their spinal column and creating symptoms because of that. Or we can test the pressure directly in the system by doing what's called a lumbar puncture. Now, lumbar puncture is where you lay on your side, stick a needle with a pressure gauge into the dura and see that opening pressure. If there's too much pressure, not enough pressure. The problem with this is also creating a hole in the dura itself and can lead to dural headaches as well. So a few things, most of the time, these are a clinical diagnosis, meaning someone comes to us, explains their story, we can examine them. Based off their history and examination, we have a good idea if this is something that's causing their issues. How to treat it. There's a lot of different treatments, and I would say 80+% of the patients respond really well to conservative therapy, meaning they just put you in bed rest, give you some analgesics. Some people do oral or IV caffeine combined with hydration and some effective migraine medications just to minimize the pain, and your body sort of heals the hole in the dura over time. If that doesn't work, the next would be basically trying to plug the hole. So we do an epidural blood patch with or without sometimes a fibrin sealant that sort of coagulates it and sticks it into the hole to stimulate your body to heal it. And in traditional medicine after that, we have surgical. So this is just an illustration of during the epidural blood patch where we're putting blood directly around where that dural leak is to see if we can get the plug, hold the plug, and then hopefully get the body to heal it. In traditional medicine, unfortunately, if that doesn't work, then they start doing operations where they go in and surgically repair the hole, and that can lead to some other complications along those lines. So now we start talking about things that we can add to this before we even get to the surgical aspect of it. So epidural blood patches are always a good place to start. A lot of people fail with that, and then the only other option is surgery. So let's talk about some of the regenerative medicines or orthobiologic options. I'm going to illustrate this via one of the patients I've seen recently and treated with a dural leak as a complication of surgery. So this was a MRI illustration of her dural leak where she had surgery for a cyst that was right here, and the surgeon unfortunately created a dural leak, and post-operatively that leak became a pretty massive blowout of the cerebral spinal fluid where it's leaking all the way out, causing not only just headaches, but the pressure in the fluid buildup is actually causing severe nerve pain as well as back pain and leg pain. So this is a 57-year-old female who actually dealt with this for almost a year, so 9 months before she got to myself. And it was a synovial cyst or dural cyst that was complicated with the dural leak. That leak eventually failed the blood patch, and then the surgeon went back in there to try to repair the leak, and then eventually had the big blowout, and the pain got so bad where the surgeon said, well, we're not helping the leak, we're just going to fuse the whole spine. And then she came to us for an alternative to the actual fusion. She had heard about us through one of her neighbors and came out for an evaluation. We were able to do something. So what did we do? So this was the dural leak itself at the time of evaluation. Again, we can see from the side view, all this area is the hole in the dura, creating some excess fluid around that area. So we used a advanced interventional orthopedic treatment with orthobiologics, meaning we did a formulation of platelet-rich plasma combined with an interventional needle-guided procedure where we were able to, 1, aspirate the fluid out of there, and 2, we did an epidural with the blood platelets, meaning growth factors from her own blood, to stimulate her body's repair mechanism to essentially heal the hole. So we were able to do this a single time. We were able to get several of the fluid pockets aspirated and drained, and then place the platelets around where the damage was to actually get it to heal. And this was the before and after. So the before is on the left-hand side. We can see, again, that fluid collection all in this area. If we go to afterwards, and this was only a few weeks afterwards, all of it is back towards normal, no big fluid collections, and even that cyst that was there is now gone, and some of the leakage into the back paraspinal muscles also was able to resorb. So this is quite dramatically, and her pain and symptoms went down dramatically, where it took care of 95 to 99% of her pain and issues that she was having. She could stand without any headaches, she could lay down, she could move around, no longer got any nerve pain, and we were successfully able to prevent this patient from having a fusion when really she never had any back pain to begin with. Before this, she had a little bit of nerve issues from a cyst, and that snowballed into complicated surgeries with dural leaks, and eventually we were able to resolve those issues with a simple interventional procedure that failed some of those other conservative treatments. And again, another before and after. So if you've been dealing with the dural leak and if you've failed some conservative measures and considering surgery, or if you're just looking for an alternative to epidural blood patches, feel free to give us a call at Centeno-Schultz.com, as well as any of our social media outlets. If you have any questions, concerns, feel free to also touch base with us. We can set up a telemedicine evaluation to discover more, a little bit about what you've been dealing with and how we can potentially help. So thank you. Have a good day.